The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show.
Hey, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. This is my co-host, Bentley. Say hi, Bentley. I'm still working on the editing for the next full episode of the podcast. It's going to be really good. It's a really nice interview with former coworker Justin Gallion about dealing with death and dying and its impact on us as healthcare workers. But I just don't feel good. I don't think it's going to happen this weekend. I've been really lucky so far seeing all these sick folks that I haven't caught anything this season. I've been wearing my mask with all the sick folks and using about 5 gallons of hand sanitizer every day. But whether it was at work or not, it finally caught up with me. So I'm just trying to take it easy. So I thought I'd just talk about a couple of things that are on my mind from this past week. There's this interesting balance that I feel like I have to strike between creating content, making this podcast, which I enjoy, but which is not really my job, and behaving like a medical professional so as not to do anything that would get me in trouble or get me canceled or tarnish my reputation or anything like that. It's not like a ton of people listen to this podcast, but you never know who's listening or who's going to end up hearing it in the future. And so I do try to be very mindful of that. I try to be open and honest and authentic on here, but I also don't ever want to say anything that would have a negative impact on my patients. I've been going back and forth for a long time about setting up some microphones at work for us to just sit around and complain about everything and record it, because it would be so freaking funny. Oh, it would be hysterical. You know, the behind the scenes talk that no one ever hears, that's not intended to be heard by anyone except the people on your team. But it's just so unprofessional, and it would just, if any of our patients heard it, it would just be a complete disaster. So I've always tried to be real careful with that. And obviously I have to maintain confidentiality of my patients. So I never reveal anything specific that a person said to me or say anything that I think would be offensive or off-putting to the person I was saying it about, even if I did it in an anonymous way. But sometimes patients will say things that make you reflect on the way you're doing things and kind of ask yourself if you could be doing things a little better or differently, or just make you think. I definitely sometimes get questions that I've never even thought about or that I'm very curious to know the answer to also. This week, a couple of questions like that came about that have had me thinking a little bit since the people asked me about it. The first was this idea that the healthcare industry, the pharmaceutical industry, is not really focused on trying to help people stay well, but to treat people when they're sick, because if they were well, that means we wouldn't make any money. And this person didn't go so far as to say it's all a conspiracy to keep people sick, but very clearly was saying that the, whatever you want to call it, the healthcare industrial complex, Big Pharma, is not doing anything to help us stay healthy. They just want to treat problems when they come about. And I can see where a person would have that point of view. Just speaking for myself, I do spend most of my time going through patients' problem lists and trying to address problems and trying to fix things that they're complaining about. But in my mind, obviously, I want everybody to be well. I would love it if we never had anything to talk about because everybody's so well, and if I never had to prescribe anybody medicine. Sometimes I notice that people are almost apologetic when they don't have problems, or they think that I'm going to be mad or disappointed if I can't prescribe them something. And I'm like, no. I want you to be healthy, first of all. Second of all, it's much easier for me if I don't have to do anything. So yes, I share that goal also. I guess, again, just speaking for myself, most of the training that I've received is how to address problems. But, that takes up all the time because there are a lot of problems, and trying to understand them and figure out what to do about them is a very complex, very huge undertaking. And other than just the basic advice, improve your diet, exercise, get a good sleep, don't smoke, don't drink to excess, eat more fruits and vegetables, all those things that we all kind of know that we're supposed to be doing or not doing. We don't get a lot of specific training on what to tell people. I'm sure if a practitioner is really interested in that, you can get very detailed and recommend specific nutritional plans or exercise plans or sleep, whatever. But I don't know really how much there even is to say. Like, to me, as soon as people start talking about wellness and taking supplements and here's this revolutionary plan that's going to change your life and you can stop all your medicines and clean out your colon and all your waste is going to come out through your feet and all this. I mean, that just immediately sounds like BS to me. And usually I think that is the case, that all those things are mostly just kind of scams, or at the very least unproven products or methodologies or whatever. I've been listening to the Maintenance Phase podcast. I think I've mentioned that on here before. And some of their views don't jive with the typical medical advice, but in general, I really like their attitude of, if it seems too good to be true, if it seems self-helpy, grifty, just buy this book and I'll tell you the secret of life, it's probably a bunch of BS. And they're really good at debunking all these specific myths and programs that are for sale and whatever. But yeah, I don't know how much there really is out there. Like, even if I wanted to stop talking about problems and only focus on health maintenance things, like, what else could I tell you that is evidence-based, And my other response to that is, I think a lot of what we do in primary care is focused on prevention. That's the whole reason to have someone come in periodically and get their blood sugar and cholesterol and blood pressure checked. The whole goal of every bit of that is to prevent cardiovascular disease down the road. And in primary care, we can handle the meat and potatoes stuff, but when super complicated things or super unusual things or things that require a lot of resources and input come up, we send those people to specialists. So I'm of two minds on this whole situation about not doing anything for prevention. First of all, I think we are doing a lot for prevention, but also I get what you're saying. I understand why you'd feel that way. And I know a lot of people must feel that way, because even though they don't say it to my face, I hear all these different things that people are doing. Oh, I'm going to this clinic over here and I'm doing this program and I'm taking this supplement. And I'm glad that people feel comfortable telling me all that, because I'm always kind of okay with it. I mean, if you feel like it's benefiting you, it's not causing any problem, then hey, go for it. Why not? Do I think there's really anything to any of that? No, but I'm not going to poo-poo it. If you feel like it's helping you, fantastic. If you want to spend the money, go for it. Because so often I feel like the things that I have to offer are just not adequate. I can tweak all the numbers and do all the things and put people on all the right medicines and all this, and somehow it's just never enough. People just still feel terrible all the time. And I feel like everybody's just out looking for the fountain of youth or the secret of feeling like you're 18 again all the time. So yeah, maybe I'm looking at that wrong. Maybe I should put more time into learning about preventative things and become a homeopath, naturopath kind of person. But I think for now I'm going to stick with the evidence and standard medical practice. And if folks want to go out on their own and do their own research and look for outside resources, hey, fantastic. Have at it, man. The second thing that came up this week is a patient said something to the effect of, healthcare people never touch us anymore, meaning patients. Healthcare people never touch their patients anymore. And she was very careful to say this in a way like, I don't mean anything bad about you, because it's like everywhere and all my friends feel the same way, that just nobody ever touches us anymore when we go to these visits. And I'm at a point in my practice where that did not make me mad. Probably when I took over and was a little more insecure about things, that would have really ruined my day. But when the patient said that, I just kind of thought about it and I thought, okay, I understand why you would say that. This was an older person, probably even in their 80s. And I'm sure that the primary care visit has changed a lot in the past, whatever someone that age would remember, 60, 70 years. First of all, in my defense, I do a physical exam on every patient I see, unless it's some very quick visit just for refills, or, if you just need me to look at your toe, if there's something very focused that I can do. But on all my routine visits, I do physical exams. I'm listening to heart and carotids and lungs, and I'm checking peripheral pulses, and I'm looking for swelling. I'm doing all these things. So for a person to say that I've never touched them is just flat out not true. I want to get that out of the way first. But I do know that the physician that I took over my practice from was very hands-on. She spent literally hours in the room with patients, and she looked at them and touched them from head to toe, inspecting the scalp, looking between the toes. Like, there was not a part of a patient's body that's able to be seen without surgical intervention that she hadn't seen. And so I can definitely understand how, if you're used to that, and then somebody like me takes over who tries to be more efficient, who doesn't have hours to spend with you, and tries to just kind of do focused exams based on whatever you complain of, I can see why that would feel like a big change. And other patients have said sort of the same thing over the years that I've been doing this. One of the more outspoken patients said, all we ever do is talk. We don't do anything, which she later apologized for. But I get it. It's a different way of doing things. I think patients probably overestimate how much information we really get from the physical exam. We learn all these little techniques and all these things that are named after doctors and all these physical exam maneuvers and things that you can do for this and that. And I think even as we're doing them in our training, we probably in our head are like, okay, I'm not really going to do this. Like, I don't have time to do this. When am I ever going to actually do this? If you want to know if they have a pneumothorax, freaking get a chest x-ray. And maybe that's a first world problem. Maybe we've all been spoiled by access to imaging and lab tests and technology and things that if we were out in the bush somewhere and didn't have anything, we would all be terrible diagnosticians because we have let all those skills go. You do hear tales of old school doctors who will show up in the hospital and like do some manual thing that nobody else would know how to do. And I'm sure that's a valid argument. I'm sure that in the past, clinicians were better with those diagnostic skills, with those physical exam skills. But it would be because they didn't have any alternative. I mean, I can go thumping around on your abdomen if you're hurting, but what does that really accomplish? I mean, if your abdomen is distended severely, I can see that. I don't need to thump around on it. If it hurts, you just told me that. I don't need to poke you to make sure that that's actually true. Anyway, I don't mean to get off in the weeds with different specifics here, but it's one thing if you're dealing with an infant or a special needs person that cannot tell you how they feel, or a dementia patient. It's more important to look for yourself in those situations and feel for yourself and listen for yourself and whatever. But a normal adult with all their faculties, and this is what I told the person that asked the question. I said, if there's something wrong about your body that you don't know, how am I going to know it? What am I going to find if you haven't already become aware of? You tell me what's wrong. You tell me what your concerns are. Yes, I can listen and thump and move you around and do all this stuff, but most of the information I need is what you're telling me. This sitting around talking, quote unquote, not doing anything, is you telling me what your issues are and me trying to figure that out and respond to it and figure out what to do. We are doing something. We're doing cognitive work. We're doing intellectual work to try to work through all the possibilities, differential diagnoses, whatever, and figure out what to do next. And I've heard other clinicians say the same thing. Like, you don't get much out of the physical exam. Even on the Annals of Internal Medicine podcast, Dr. Centaur, who I've actually had the chance to learn from in person back in the day, even he said one time, most of the important stuff that you get is going to be from the history. You might get some things from physical exam. So I think maybe that's like one of the big open secrets in medicine is that we don't really get a lot of information from all that stuff. I will admit that sometimes when I'm listening to lungs and doing all those things, I just feel like it's because I'm going through the motions. It's because I feel like that's what patients expect, and that's what I am trained to do, and that's what I ought to do. I have definitely seen physicians and other healthcare people literally not touch the patient when I thought they should, or do a quote unquote physical exam that was obviously fake. Like, there's no way you could get any information from this very cursory thing that you're clearly doing just to fool the patient into thinking you're examining them. Oh, come to think of it, I've even heard the curbsiders talking about there being not much utility in having to listen to everybody's lungs. So if people like that are having the same thought, I can't be too far off from everybody else. And at this point in my career and my practice, I try not to let statements like that make me question my life too much. I feel comfortable with what I'm doing. I feel like I do an adequate amount of examining people to figure out what's wrong with them or to rule out things that I can rule out. Like, I'm not saying every physical exam maneuver is useless. I would say you usually don't learn much from listening to the lungs. Hearts are a different story. I pick up on a lot of heart murmurs that people would not know they have. And of course, most of those are inconsequential, but it is kind of neat to go, oh, did you know you have a heart murmur? And if I've never told them before, invariably the answer is going to be, oh yeah, Dr. So-and-so told me that 20 years ago, but nobody else has ever said anything about it. Or, no, I didn't know I had a heart murmur. I think it's worthwhile to listen to carotids. You can hear bruits. It's worthwhile to feel the thyroid. You can feel a nodule if one side's obviously bigger than the other side, or if the whole thing's massive. Peripheral pulses, you can assess somebody's circulation without having to send them for a test. I was talking about the abdominal exam earlier. I don't think the whole abdominal exam is useless, just to be clear. It is good to know what someone's bowel sounds sound like. You can glean some information from that. If there's guarding or rebound tenderness, that gives you information that the patient wouldn't necessarily tell you. Examining the skin, I'm definitely guilty of not doing head-to-toe skin checks on everybody, but I always ask at their physicals, and I at least look at their back where they cannot see, and look over the common exposed areas where skin cancers tend to show up. But I also encourage them to go to dermatology for regular skin checks, just like we generally encourage our patients with female anatomy to go to gynecologists and be checked there, because I'm not an expert on those things. I could do your pap smear. I'd probably notice if something's really wrong, but that's just not my area of expertise. And if I had female parts, I think I would want an expert to be checking me when that has to be done. So anyway, I guess my answer to the original question is that I hear what you're saying, but there's a lot of thought that really goes into this other than just let me lay my hands on you and I'll be able to, number one, diagnose you, and number two, heal you, because that's pretty much never true. I definitely like the idea of being able to diagnose something or treat something without sending the patient for some kind of test. But I also know that those tests are going to be a way more accurate bit of information than whatever I can glean with my eyes, ears, or hands in most instances. So there you go. There are the, maybe not complaints, but concerns about the medical system that have been on my mind that were raised by patients this week. I always have my ears open for things that I can use to make podcast episodes out of. And I usually tend to think of patient statements as being off limits. But for this kind of thing that just turns into like a broader question about healthcare in general, maybe I could make some more episodes like this. Let me know what you think. If you have any broad questions that people have asked you that have stimulated you to think, or any questions that you have that I could try to answer, reach out and send them to me. I will be working on editing the next full episode, and I'll get that out to you as soon as I can. Thanks to everyone for listening. Special thanks to our Patreon supporters. I hope you have a great week, and I'll talk to you later.
All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters. If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic, or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order.